the Germans did a systematic evaluation of patients with cardiac MRI after their surge in the spring. And they found out that over 70% of patients had evidence of cardiac inflammation involving either the heart muscle or the lining around the heart or both structures. Mm-hmm. So it became apparent that cardiac MRI was one of the best methods to detect inflammation of the heart. So we've had a number of cases that we've done, and over the past 8 months, we found that 57% of the patients that have cardiac symptoms after COVID do indeed have inflammation. Again, either of the lining around the heart or the heart itself.
And is that just patients that they've had here in this area, or is that patients just in general?
That's patients, and this is our experience here at Sharon Regional.
But the phenomenon's happening
everywhere.
Yeah,
yes.
Anywhere it's COVID, it's the same thing.
If you go to a hospital with a heart attack and they don't have the capacity to do an intervention to open the artery, and they send you to a larger institution to have that done, the door to balloon time does not start with the first hospital that you went to. It starts with the time that you got at the institution that is doing the procedure. And that was done out of fairness to the institution that was doing the procedure, so that they would not have these prolonged door to balloon times. But if you're the patient, okay, you want that artery opened up as quickly as possible to salvage as much myocardium as you possibly can. Brandon does interventional cardiology, which is inserting tubes to do procedures on arteries and valves. What I do is imaging that leads to his procedure. And one of the big modalities that we use is magnetic resonance imaging, or MRI, and the other one is CAT scanning. And those have been available for cardiac work since about 2004. So it's a relatively new way of looking at the heart. Sharon Regional has gotten a platinum designation from the American College of Cardiology every year for the past 6 years for heart attack care, which is absolutely terrific, okay? And I think that the people of Sharon, Pennsylvania and the surrounding areas that come to Sharon Regional, they need to know that if they're having a heart attack, if they choose to come to Sharon, they're going to have a very high level of care for that specific problem.